Too real.
You're dead to me.
We have an emergency. My brother's been shot.
Everybody clear the way. There's no pulse. The patient's not breathing. He needs to start CPR right now. Get him out of here. Let's go.
What?
Breaths. Doctor says we need to take him to surgery.
All right.
Is my brother okay?
Yes, he had a gunshot wound to the chest, but as you can see from the x-ray, we got it out successfully and he's stabilized.
Are you okay?
I'm doing good. I don't know how you guys keep people doing all that.
It's all in a day's work. Working with an awesome team helps too.
Yeah, I think I want to be ER nurse when I grow up. How is it different from other kinds of nursing?
Yeah, sure. We'll explain to you how.
Emergency nurses treat patients in emergency situations where they're experiencing trauma or injury. We have to quickly recognize life-threatening problems and help solve them on the spot, treating a variety of conditions from sore throats to heart attacks for all patients and all backgrounds. Working in the ER can lead to long hours and danger since you're exposed to different pathogens and patients.
These may include illnesses as well as injuries from accidents or crimes. Some situations include poisonings, dangerously high fevers, broken bones, drug overdoses, car accidents, stab wounds, gunshots, heart attacks, and strokes, just to name a handful. Often it's a chaotic environment, and not only do we have to deal with the patient, but also with the patient's family because they are in a state of panic or fear for their loved one.
What's trauma?
Trauma is a state of emergency, and often we handle urgent cases where the case of injury isn't severe or the disease isn't known. We have to be confident and knowledgeable in our split-second decisions. We respond to different codes such as code STEMI, the case of a heart attack that we have to treat in the first 90 minutes, code stroke, code blue when a patient needs resuscitation or medical attention, usually cardiac or respiratory arrest. Some of these codes come with an ETA, an estimated time of arrival, so the medical team can prepare for the equipment necessary before the PT arrives.
The first step is always to stabilize the patient. This means the team will make sure the condition doesn't get worse. You need to be quick and be able to do procedures, such as starting IVs, giving meds, transfusing blood, CPR and rescue breathing, suturing, setting broken bones, you name it. We never know what's going to come through those doors. Patients are considered stable when their airways have been cleared, bleeding has been controlled, and fractures have been immobilized.
Wow, sounds like an adrenaline rush.
Yep, make sure you get your certifications too. It can really expand your knowledge. For example, you can work in hospitals and ambulances, but did you know you can work in helicopters and get your flight nursing certification? You can even do sports arenas and other stuff too. It's pretty cool.
There are certifications in emergency, flight, pediatrics, and critical care ground transport, but you gotta make sure to renew your certifications every 4 years by taking an exam or by having continued education hours.
After learning all this, it sounds like the job for me. I can make a difference and definitely won't get bored of this for sure. I'll be able to work with people of all ages and utilize a lot of skills and work in different settings if I want to. It's probably going to be exhausting physically, mentally, emotionally, but I can make sure people live another day.
Good job.
He's not breathing. We need to start CPR right now. Come on.
Doctor says we need to take him to surgery.
All right, let's go.
This.
Maybe we should switch.
Knock knock.
Is my brother okay?
Yes, as you can see, we ended up getting the wound out. stabilized. Are you okay?
That's good.
She said we got the wound out.
I was trying not to.
Did you see me? Because I'm waiting for you to go.
Is my brother okay?
Yes, he had a gunshot wound to the chest, but as you can see from the x-ray, we got it out successfully and he's stabilized.
Are you okay?
I'm doing good. Am I supposed to say something else? Oh,
Yeah.
Oh, okay, my bad.
I think you.
I don't know how you guys kept your cool during all that.
It's all in a day's work. Working with a good team helps.
Wow, sounds like an adrenaline rush.
There are certifications in emergency, flight, pediatrics, and critical ground.
She just shut down, man.
Critical
That was a
ground.
good one. That was
Critical care. Ground.
Hey,
Critical
can
care.
we do that with like this in the middle?
Yeah, there's certifications in emergency, flight, pediatrics, and critical care ground transport. Yeah, but you do. Fuck you!
She got through the critical care.
Critical.
I'm very bad.
That was critical, Jamie. That was